I just wanted to say a few words to introduce Roman before we get started. Roman is a reader in organisation studies, and he's acting head of the Decent Work and Productivity Research Centre at Manchester. He's also an honorary senior research fellow at the Institute for Health Policy and Organisation at the University of Manchester. And he's an adjunct professor at the Australian Centre for Health Services Innovation at Queensland University of Technology. So Roman's research is all around practices and processes of knowledge mobilisation, and he's got a particular interest in communities of practice, intermediary roles, and organisational learning and implementation of change. So we're really looking forward to hearing you talk today, Roman, on knowledge brokers. We've recently, I guess, worked more closely together on a cross-arc project on co-production, which is an interesting little bit of work. So that's how I've got to know Roman recently. An interesting fun fact that you may not know already, for those of you who know Roman, you may not know this. He used to work as a doctor in a gold mining company in Central Asia. So there's a fun fact for you today to get us started. But welcome, Roman, and we're really looking forward to your talk. Just some housekeeping. We look forward to having 15 minutes at the end of the talk to take questions. So feel free to put questions in the chat, or you can put your hand up at the end of the talk as well. We'll take the questions in the order they come in at the end. So, and we're also going to record this seminar so we can put it on our YouTube channel for others to view later on, if that's okay. If you don't want to appear in it, then please feel free to turn your camera off. But that's it from my side. And over to you, Roman. Thank you.
Okay, thank you for a lovely introduction, and coming from the fun fact to the actual essence of the talk. I think even from my brief biography, it's apparent that I've been around several communities of practice, and I'm very much a knowledge broker, because you've heard organization studies, you've heard about my medical background, and I'm also doing health services research. So jack of all trades, master of none, and I think that pretty much applies to all people who believe they're knowledge brokers. So a lot of things that I will be talking about today are actually related to my personal experience, in addition to all the research that I have conducted over the years. The inspiration for this talk was a paper that I published 3 or 4 years ago, which was called The Dark Side of Knowledge Brokering. And you might ask, okay, you already published that paper, why do you keep talking about it? So this talk is kind of an update on the paper that was published. So it summarizes the brief argument from that paper, but also brings together some of further research that we have conducted over the last several years. So this is not just the paper in the Journal of Health Services Research and Policy. This is a little bit more than that. Okay, so before I start, I think I need to give you a definition of knowledge brokers. So this is quite a sociological definition: agents who bridge a gap in social structure. And not only do they bridge a gap, they also help knowledge flow across that gap. They enable coordination and alignment between different perspectives, and they facilitate interaction. So from that definition, it's clear that knowledge brokers can be found in different walks of life, in different sectors. All of us, occasionally at least, play a role of knowledge brokers. Very often in the literature, they are also called boundary spanners. Some people believe there are slight differences. I personally think these are just synonyms. But talking about healthcare, I think it's important to give examples of what knowledge brokers look like in our field. So in the context of healthcare, knowledge brokers are expected to promote interaction between researchers and practitioners. So that's the most frequent context. in which we can find knowledge brokers in healthcare. And the whole notion of clerks, or currently ARCs, is largely around establishing those structures for institutional knowledge brokers, knowledge brokering, and ensuring that there are connections, productive connections between researchers and practitioners. And the whole purpose of this is to actually mobilize research evidence into clinical practice. And from the pictures, you can see that there is clearly a perception of the gap between researchers and practitioners that needs to be bridged or brokered. And sometimes it's not easy. Okay, now from definition, we can proceed to classification of knowledge brokering. And I think it is important. So some knowledge brokers, they are just organic. For example, hybrid roles like clinician researchers, they come into brokering quite naturally because they belong to two different camps at the same time. On the other hand, especially in the clerks and ARCs, knowledge brokers can be designated. So these are formal roles that exist in an organization. These are people whose official remit involves brokering knowledge. So in the first iteration of the clerk in which I worked, we had a pool of knowledge transfer associates. So this was a fancy name for talking about knowledge brokers. In the second iteration of our clerk, we had facilitators. And of course, the difference is quite profound, because although both of them are charged with translating knowledge into action, having a person who is called a knowledge broker doesn't necessarily mean that they will be actually playing that role effectively. And sometimes they have quite a few limitations into how they can effectively transfer knowledge into practice. Another classification, another dimension is about the position that the broker occupies in relation to an organization. So brokers can be internal, working in the same organization into which they bring this research knowledge. Or, like in the case of our previous clerk, they can be external. For example, knowledge transfer associates were based in the clerk, but they worked with primary care practices, helping them translate research into practice. And of course, being external sometimes have additional difficulties, because when you are an outsider, of course, you can have benefit of a critical distance, but then you do not necessarily understand the culture or embedded enough in the culture of the organization into which you are brokering knowledge. And another important classification, which I will be using quite a lot throughout the presentation, it's about the dimensions of knowledge brokering. So knowledge brokering is not a homogeneous, uniform activity. It can be seen as a combination of three quite distinct types of activities. And this is Vicky Ward's classification. Vicky is one of the first people who started conceptualizing knowledge brokering in the field of health. So there are three dimensions according to her. First is knowledge or information management, which is all about tools that enable managing information and translating it. Electronic systems, checklists, something more tangible. The second dimension is linkage and exchange, which is all about connecting different groups and sharing ideas and enabling forums for knowledge sharing. And the third, my favorite dimension, to be honest, it's all about promoting and enhancing learning. And sometimes it's conceptualized as capacity building. In facilitation, you actually come into the organization or into a team or work with the team in order to enable them to learn how to translate research into practice. So it's an enabling role. Enabling is the key word here. Okay, now effectiveness of knowledge brokering. I assume there are quite a few health services researchers here, and they would ask, how effective is this strategy? And we have a systematic review published in Implementation Science 5-6 years ago, and their conclusion is that there is insufficient evidence. As probably most systematic reviews conducted on our field, evidence is always insufficient and inconclusive. But it's quite skeptical. And I would like to pose a couple of questions. And in a way, this presentation is not only about the dark side and bright side of the knowledge brokering, it's also about thinking about research questions that we pose and limitations of our knowledge. So why is evidence insufficient? Potentially, there are three problems. First, potentially, there are problems.
Roman, I think you're on mute somehow.
Okay, so I will repeat. So I don't know what happened, but I should be audible now. So potentially one of the problems is that the question is wrong. Another possibility is that the data are wrong. There are problems with the data. And another possibility is that there are problems with knowledge brokering itself. So these are the three questions that I will not try and address right now, but I will come back to them after I talk about the dark side. Okay, dark side. So dark side is everywhere, because whatever we try to improve by introducing a system of purposive action, we will inevitably have secondary outcomes which will work as unintended consequences. That's the nature of social life. Very often we try not to think or look at those issues because we want to be positive and optimistic. And in knowledge brokering, trying to use them as a strategy, there are inevitably challenges and unintended consequences. So those challenges and unintended consequences I call the dark side of knowledge brokering, and I will be talking about three different types, three different manifestations of the dark side. The first one is tensions between different dimensions of brokering, the ones that I have described in one of the previous slides. The second is about tensions between different sources of knowledge. And the third is about tensions arising from the in-between position that knowledge brokers occupy. So one slide per each of the tensions. Between different dimensions, very often what we see is that knowledge management activities, that is using tangible resources, tools, and other very often electronic systems, they become dominant, or especially over facilitation, especially over learning and enabling learning. I will give you an example. For example, in our project, we started improving identification and management of chronic kidney disease patients in primary care. And initially, the main thing was the team approach, where our external facilitators worked with clinical champions and their teams in primary care organizations, improving the processes through which patients were identified and managed. Everything worked well, there were very good outcomes. We even had a ref input case. Then another clerk designed an electronic tool that replaced much of the manual labor and helped practices identify those patients electronically, and that's amazing. But throughout the subsequent adaptations and iterations of the whole project, what we saw is that more and more emphasis was put onto knowledge management tool rather than on learning about how to manage them. So in the end, learning aspects, facilitation aspects, enabling aspects received less attention. And enabling was replaced by doing themselves. So our external facilitators, rather than enabling people in primary care, improve things themselves, found it easier to actually run the electronic system and then make changes and identify patients themselves. So the outcomes were still good, but they were not sustainable because it was external people who were in charge of that rather than the practice people themselves. So that's an example. Second tension between different sources of knowledge. And here we have clinical knowledge, managerial knowledge, and contextual knowledge, in addition to research knowledge. And the question very often for a person managing an ARC is, if we want a knowledge brokering person, who do we deploy? Who do we employ, hire for this organization? Is it a researcher, doctor, nurse, or manager? And there are advantages and disadvantages. So if you hire a researcher, they know their stuff, they know research, but they probably don't know context and they don't have management skills because they were not trained as managers. If you deploy a doctor or a nurse, well, probably doctor won't be interested at all because they do medical stuff. But if you deploy a nurse, they will of course have good clinical and contextual knowledge, but they may not have sufficient managerial authority to influence their peers or people occupying higher roles in the healthcare hierarchy. And if you deploy a manager, they will know managerial stuff, they will know contextual elements, but they will not necessarily have enough expertise in clinical issues. And this will be a negative thing about them. So basically, whichever group of those professionals you look at, you will always find some advantages and disadvantages. So the question is, which of these 4 types of important knowledges do we have to use, and also how to broker this knowledge? And these are very important questions every project has to grapple with. My favorite attention is in-betweenness, because I have experienced it many times myself in my career, and I'm still experiencing it. So lots of things here. Very often it's an unclear career path because you don't know where you're going, whether you have any opportunities for promotion, where you belong. In my case, do I see myself as an organizational studies person or a health services researcher? Where do I prioritize? How do I construct my promotion application? These are all very pragmatic, all very real questions. Very often, if you work alone in the big team and you have this knowledge brokering hat, and if you're junior, very often, I think, you will feel isolated. In many organizations, there is lack of organizational support. Very often, your role is unclear and lacks guidance, and some people see it as an advantage because they manage to carve their role into their career, and some people would like a little bit more guidance than that. Very often you navigate between multiple powerful groups, senior researchers, senior clinicians, and it's very difficult to be neutral and equal in how you relate to all these different competing factions. Recent research shows that in reality, knowledge brokers always prioritize one of the sides. So they either become very much on the side of the practitioners against researchers, or very often they become allies of researchers. And of course, that creates very different power dynamics in the team and in the broader organization. But most often, knowledge brokers are junior people, unless this is a leader who is an organic knowledge broker, of course. But in my experience, if you have designated knowledge brokers, these are junior people overall with limited power and authority, and we ask them to make significant changes how teams operate. So now coming back to all these previous 3 questions that I posed, why are findings about knowledge brokers' effectiveness inconclusive? Let's try and reflect on that question with all the information about the dark side in mind. So the first possibility was that there are problems with knowledge brokering itself. As I said, yes, there are multiple tensions that will stay there. Knowledge brokers are charged with managing their context, but context sometimes is extremely powerful. A context becomes an active actor in a way and interferes, and sometimes it's not manageable at all. The big practical question here is, can an individual, especially junior knowledge brokering person, cope? And if they can't, then how can we expect that knowledge brokering intervention will be successful. The second possibility that I posed was potential problems with the research data that we collect about knowledge brokering. Most of research cited in that systematic review and subsequent research doesn't really look on outcomes properly. They mostly describe the processes of knowledge brokering. There are also always difficulties identifying and attributing indirect and intangible and also delayed effects of knowledge brokering. Sometimes the immediate change is quite subtle. It's a change in organizational culture, and then that later can improve translation of research, but it's quite difficult to capture. The big question here is about whether RCTs are the best way to explore knowledge brokering interventions. And I will give you examples later of some of the RCTs that were conducted here. And if RCTs are not the best for exploring knowledge brokering because it's such a heterogeneous family of interventions, so maybe we need to do more multiple case studies, pragmatic trials, realist methods. The third question that I posed was about problems with effectiveness question. So as I said, knowledge brokering is not one strategy. It can take multiple forms. It can be enacted by multiple professional groups, which can have different positions in the organization and in the context. So how can we say, is knowledge brokering effective if there is not one type of knowledge brokering? How do we account for myriad contextual factors? This is a citation from the systematic review. So perhaps the only question that we can realistically answer here, rather than this big question, is knowledge brokering effective, is under which circumstances does a certain strategy containing knowledge brokering have the greatest likelihood of producing some positive impact? Well, I'm a qualitative researcher, so I guess I'm extremely biased in this slide. So this is the disclaimer. And so I would say I'm a critical realist, implicit and hidden critical realist. Right, now I promised that I will give you some examples of more recent research, and out of the 3 types of knowledge brokering, I think I will focus just on one, on facilitation. I always show this 3 papers published in Implementation Science because that was a trial of facilitation, comparing dictatorial facilitation, empowering facilitation, and no facilitation at all. And the main outcome was that actually no facilitation works better for that intervention than any type of facilitation. This is a negative results trial, right? So in addition to publishing their negative trial, the authors did a brilliant job writing 2 qualitative papers on top of that from the same data, explaining why their trial achieved those negative results. And in the subsequent slides, I will also draw on my own paper about how facilitation evolves over time. And Jill Harvey is the person that is a co-author on each of these 4 papers. So I think she is one of the most important people working in the area of facilitation at the moment. Right, so the question is, if we know that knowledge brokering is not always successful, when is it successful? And again, here I'm only talking about facilitation as one of the types of knowledge brokering. So this is from one of the 3 papers that I have shown to you. So there are lots of enabling factors. Organization needs to prioritize it. There needs to be support not only from managers, but also from people on the ground. And resources are very important, which is a big thing now during COVID, where everything is deprioritized and we can't do anything really. So if we have those enabling factors, then we can hope to have collective engagement. And then facilitators come into play. They already have, presumably, some skills and authority. And it works together with collective engagement and eventually leads to learning And learning works two ways, because facilitators bring learning in and also learn from the team and from the whole context, which makes them even more skillful and authoritative. This whole chain absolutely has to be sustained over time. If it doesn't, everything gets eroded, and facilitation turns into something more like information management, checklists, protocols, electronic systems, and no learning at all. Right, so now let's see another conceptualization here. So in many sources, you will see that knowledge brokers and facilitators are a catalyst for change. And a catalyst has a chemical definition. It's a substance that speeds up a chemical reaction. Right, it's very important. It does speed up a chemical reaction or a knowledge transfer reaction. But you still have to have all the other things that I have shown. Sorry, I have switched the slides too early. If you don't have prioritization of facilitation, managerial support, resources, and collective engagement, there is nothing to catalyze. And of course, if the context has this shape, then knowledge brokering in this context might not be as effective as you would hope. Okay, so I've been talking about the dark side. What is our advice for moving forward? Much of this probably is not always achievable because it's resource intensive. The first thing that we try to advocate is that most often knowledge brokering can't be done by one person. You can't do it on your own. Knowledge brokering, if it is to be successful, is usually a collective process involving teams and multiple individuals. You need a team in which you will have multiple people, all of them doing some knowledge brokering, and this team has to be multidimensional because you have to have not only different types of knowledge brought together, managerial, contextual, research, clinical, but also ideally you would like to have a combination of internal brokers and external brokers, people coming from outside with their expertise, with the authority, influence, and internal knowledge of people who already work in the organization that you want to influence. And because knowledge brokers are very isolated, unsupported, inexperienced very often, there needs to be some organizational mentorship, ideally by people who are more senior, more experienced as knowledge brokers, who have survived the difficulties. One of the most unexpected reactions to my paper about the dark side was from a person who was a knowledge broker in Canada. And she emailed me and said, "Thank you so much. I read your paper and I do recognize all the difficulties and challenges. And it made me realize I don't want this job any longer." So I can probably, it's evidence of impact. Not sure if this is positive or negative impact of my research on people's careers and well-being. And the second component, in addition to seeing knowledge brokering as a collective process, is also about fostering the supportive organizational environment. And it's easier said than done, because especially now, everyone has to prioritize. And when we wrote it 5 years ago, it sounded probably more realistic that knowledge brokering is part of everyone's core business. I don't know what can be seen as everyone's core business in the current situation, apart from COVID, apparently. So if we want to have effective knowledge brokers, we need to provide learning, development, and promotion opportunities. And this is all down to organizational leadership. And even more, higher than that, it's down to the whole sector, I would say, because at the moment, these people lose out a lot. It's easier to become just a clinician or just a researcher rather than being in two camps, unless you are exceptionally lucky or exceptionally talented or both. However, saying that, very often what we saw across multiple countries is a small but very influential and productive cadre of professionals who I mentioned before. These are hybrid researchers, clinician researchers, very rarely manager researchers, that also exists. If that works, then it's extremely productive. But the main problem here is replication. I think it's all down to a combination of a very, very skillful and talented individual, plus an organizational context that is receptive to that. I don't think we can have an army of hybrid clinician researchers, but we'll always have some people who will be highly successful in that direction. And of course, talking about co-production in the beginning, one thing that this presentation basically ignores is that we, in addition to all the groups that I've mentioned, it's extremely important to have research users feeding into all the knowledge brokering process in teams that are taking place. So this is a gap and a limitation of my own previous research, lack of attention to research users. Okay, so the conclusion is it's everyone's business and not just one individual that has to overcome all the obstacles. So that was the end, but I still have 2 slides as an epilogue. That's another paper in Public Admin Review that we published 2 years ago now. It's based on 4 countries. It's about nursing, and there is some element about knowledge brokering there. So what we tried to show is that very often organizations rely on chains of codified knowledge, which starts with clinical guidelines, but then get transformed into policies and procedures, performance standards, further down the line get simplified into protocols and checklists. And these are the things, protocols and checklists, easy things, short things that get used by nurses for their decision making. And in addition to that, of course, patient preferences are important, and experiential knowledge of people who apply evidence-based medicine is important. But what's important for our topic is that it's knowledge brokers who do the job of translating the complex research and clinical language of clinical guidelines into something simple, like protocols and checklists that all clinicians can quickly apply. So on the one hand, you do have in this chain a very clear integration of contextual knowledge at the bottom and research knowledge, and that reinforces evidence-based practice. So on the one hand, it's very much the bright side of knowledge brokering, because you translate research into practice, but in this case through different sources of written text rather than tacit knowledge. But exactly the same picture can be interpreted from the dark side perspective. And that's what we did in the paper. We did both things at the same time. So you can interpret that as loss of information, because clinical guideline is comprehensive. It applies to multiple groups of patients with multiple types of a condition. And if you simplify it to protocol checklist, like half a page, then you lose lots of important information. And as one of our participants said, nurses are getting dumbed down by that. So is collective knowledge brokering successful if we use this dark side lens to answer that question? So I think the biggest conclusion that I wanted to make in this talk is that whatever we do, there's always going to be a dark side, and it's impossible to completely avoid it. It just probably, the question is anticipating what it will look like and trying to minimize it. But it's unrealistic to just always be on the bright side. Okay, I think I'm done. Thank you.
Fantastic. Thank you, Roman. Really nice to have the opportunity to really delve into what knowledge brokering is all about. It's one of those kind of concepts which I think everyone thinks they know a little bit about, but you've laid out really quite clearly, you know, what the processes are that are involved in knowledge brokering, some of the tensions, the kind of the skills and the experience that are needed to do it well. So thank you. Really interesting talk. So, and I actually think we've got quite a few hybrid clinician researchers in our audience, and I look forward to hearing from them if they have any questions to pose to you. So I'm just going to open it up. We've got about just short of 20 minutes if people have questions. I can't see everybody, so maybe just, yeah. Okay, Ange, I think Ange has got her hand up.
It's not really a question, it's a comment really. I really enjoyed your presentation and a lot of it resonates with me in a role that I'm doing currently in the organisation. And just a sort of comment on how much kind of health policy and kind of culture within organisations influences the way that you, or constrains the way that you try and broker that knowledge between you know, two practitioners on the shop floor. And I wondered if you came across this with any of your work around the kind of top down, like the hierarchies that you're talking about, and how you overcome that.
Well, certainly from my personal experience and from all the research that we have conducted and analyzed, that does come about as a recurring theme, and it is much less in terms of what can be done about it. Because if you have this existing culture and existing hierarchy, and you try to change things, inevitably there are limitations to what you can do. So people often, I think, rely on their own soft power, soft skills, manipulation, trying to influence people indirectly, making alliances with powerful individuals, influencing others through people who are important points of reference for them. But I don't think there are any prescriptions, unfortunately, that can be given. I would say this is a very difficult job to do. And from your own experience, Ange, is there anything, any insights that you have learned on the role that you would like to share with us, maybe?
I suppose I'm just starting on a new role in the organisation as part of the Magnet for Europe UK research study, where they're trying to translate the kind of organisational model around Magnet in the US to the UK. And it's just really interesting as I start to work on that, how my sort of senior colleagues in the organisation perceive how that should be done. And that is about trying to get that knowledge around and the evidence around Magnet into a UK hospital. And it's just fascinating how people kind of apply the ways of working, how they might do in their roles as clinicians, you know, where you talked about the role of the clinician, the role of the manager, and that's just really interesting because it's not the way that I would go about doing it as a researcher. And actually how I feel a bit, this is quite a personal reflection, how I feel a bit kind of torn really about being able to kind of influence that. And I suppose that's what I'm saying around the kind of top-down approach that you know, a lot of the knowledge brokering is top-down driven, isn't it? Because, and even like you say with the policies and guidelines and how you might have this dumbed down version, but we know even if you get the dumbed down version, often that doesn't get used in practice. So that would be my kind of, that's the challenge that I'm dealing with at the moment. And you're right in the sense that it's about having some kind of authority as well to help drive the decision making, isn't it? And getting people on board. And how do you do that when you might not be in an authoritative position?
Absolutely. And another useful metaphor I find is wearing multiple hats, especially talking to researchers who get into the whole making a real difference think. Because very often, if you are trained as a researcher, you do have quite specific ways of looking at the world. And we are so schooled in that we believe this is the most appropriate and normal way of behaving. Unfortunately, when we get in contact with non-researchers, we realize that evidence and rigor are not necessarily things that make them tick. So in our world, these are the most important things. But in the world of management and policy particularly, priorities suddenly shift. So what many researchers find useful is almost forgetting for a bit that they are researchers and trying to use the language and the framing that the other groups utilize. It's very difficult, it requires constant cognitive framing and reframing, almost using multiple languages and switching between them. But hybrids, very often, I think this is their strength. If they're fluent in both languages, then they can switch between the two.
Thanks for that. That's really useful insight, because for me, I think it's to kind of affect the change and get that evidence into practice. It's about, you know, walking about on the shop floor and doing it that way, where often I think the approach is just, like you say, constantly pushing information out, which doesn't get embedded, does it? And it doesn't get used. So there's a lot of behaviour change, isn't there, that's required when you're trying to do these things.
Absolutely. Thank you for sharing your insights. Every time actually I give a talk on a similar topic, I always find that the discussion is largely about self-therapy and sharing experiences rather than questions about the research side of knowledge brokering. And that does show me that even 5 years after we published the initial paper, it still resonates with experiences of people who are caught in this liminal boundary position.
Great, thanks Ange and Roman. Really interesting discussion. And Ange, we look forward to continuing to learn, you know, from your journey as you go with your new role, and particularly around the brokering side. I'd be interested to keep in touch with you on that. I've got another hand up, Charlotte. We'll take a question or a comment from Charlotte.
Yeah, hi, hello, thank you. I was a little bit late because I've just been on a long COVID morning presentation from Westminster, so that was really interesting. But what I'd like to ask you, Roman, in the long COVID research space, the voice of the patient or those experiencing living with long COVID is so important, particularly when the evidence and research is emerging, and there's a lot that isn't known about that condition. So I was just wondering what your views were around integrating people's lived experience and being a knowledge broker in that space as well. I just wonder what your thoughts are on that.
Yes, absolutely. And I'm conscious that my presentation ignores patients and the public, and largely it's a function of it being based on research from 5, 6, even 10 years ago now.
Yeah.
But I think now, importantly, with all this constant emphasis on involving service users and co-production, I think it's absolutely legitimate to see patients and the public, especially their active representatives, as very valid and legitimate knowledge brokers. And that's exactly what we are seeing in the field of long COVID, because it's people who are afflicted with that, people who are suffering from it, engage with the media and try to convey their message across, because in the beginning, most of the medical profession, as we all know, didn't take them seriously. So I think this is a good example of how activism can also be seen as a part of knowledge brokering. And this activism as such is not part of the initial classification of dimensions, but I think it is very different in many ways and important in its own right. So I think it's two things here. We do need to engage with the victims in general, service users, patients, carers, and other types, and also look at the activism angle and to see the bright side of it and the dark side of it.
Yeah, okay. Thank you, Roman.
Thanks, Charlotte and Roman. Do we have any other comments or questions? Yeah, we'll go Rebecca. We'll go Rebecca and then Suzanne. Thanks.
Thank you. I've just been having a chat privately with Siobhan because I couldn't find my hand up emoji anywhere. I'm not sure I have one in my reactions. Might have to speak to somebody later about that. That was a really interesting talk, Roman. Thank you. And as Helen said, just to delve into an issue like this and explore it in a bit more detail was very illuminating. I'm really interested in the role of academics in this space, and I think what you seem to be concluding was that it's a challenging role if the role is a kind of given role and that you do this as basically your full-time job. But I wondered whether you felt that in the changing world of academia, particularly in our space, health services research, social sciences and such like, whether it's actually possible to do your job without being a knowledge broker and do a good job. I feel there are most of the individuals on this call do knowledge brokering as part of their job, and some of them more than others. So Jane Maron, for example, a lot of her job is spent knowledge brokering. It's not her title, but that's what effectively she's doing. And we all, I think, do quite a bit of this work. Do you feel that that's the direction we should be traveling in, where it sounded like at the end of your talk, you were suggesting that we all need to be doing this as part of our jobs rather than have exclusive roles for this? I'd just be interested in your view.
Thank you, Rebecca. I think it's a very important question, and my colleagues and I have been thinking about that quite a lot recently. So on the one hand, absolutely, a lot of academics, particularly those who are genuinely interested in making a difference, those in applied disciplines, those passionate about having impact, all those people inevitably are part-time knowledge brokers, because unless you're a knowledge broker, you won't be able to pull together a successful ref impact case or to basically conduct a successful health services research program, because it does always involve a significant implementation component, or at least it should. So I think that this is definitely there, and with many developments on the research funding front, REF, as I said before, it's definitely clear that impact is seen as something that we have to aspire to. So in a way, knowledge brokering activity is incentivized. However, what we are also seeing is that it's extremely unequal between disciplines, especially if you compare health and non-health disciplines. And also there is quite a lot of diversity in terms of variation in terms of different levels of seniority. So if you are a senior academic with existing networks, significant expertise, and lots of people working for you, then you are much more likely to have a successful, well-rounded portfolio, bringing together research activities, implementation activities, impact, because again, you are a head of a team or an institution. But what we see with junior people who are starting their academic careers, despite all those institutional incentives to do brokering, very often they are almost being forced to prioritize very much, mostly research, and focus on research outputs, in the hope that once they progress and then they have more people working around them, then they will be able to do more knowledge brokering. So the current system, it's not completely ignoring knowledge brokering and impact, but I don't think it provides a clear pathway for people wanting to move from more junior to more senior position, retaining the interest and expertise in knowledge brokering. So it's black and white, and it's grey. It's multidimensional.
Thanks, Roman.
Right, thank you. Suzanne, you had your hand up. I think we've got time for you to take your question or comment.
I did. It's more of an observation, really, and to thank you. I feel very seen through this this presentation, having a background as a pharmacist, currently lecturing in academia, and just finishing my PhD. So I have kind of research hats, lecturing hats, pharmacy hats, trying to grapple my way through what that means as a job, which often I feel like, as I look at jobs, having to choose a hat to wear. And also working across disciplines as well. So I work across the Faculty of Health, and my PhD was dementia focused, but also patient safety hat as well. So I've got all these different, like you said, teams of people all over the place, and lots of networks, and kind of knowing which way to turn is tricky at the moment. So firstly, I just wanted to say thank you, because it did feel a bit therapeutic actually watching the presentation. The other thing was, in my PhD as well, it was transitions of care focused. So it looked at systems and policy and guideline implementation within hospital sites and care home sites. And just as an observation there, I didn't know whether you had ever looked at knowledge brokering or implementation of policy within social care as well. But there did seem to be a difference of how social care staff perceived policy and used policy and guidelines to inform their practice versus healthcare staff. I didn't know whether that's something that you'd ever looked into.
I haven't looked into empirical research in social care, but I think this is a very important observation, because as we know, social care context is very different from healthcare. It's more fragmented, less centralized, and more underfunded. And in addition, they have, compared to health, less evidence from research and more evidence from policy, relatively. So those contextual things would inevitably change the dynamic. So I think this is an interesting research question. Maybe someone has already answered it, but I'm not familiar with any empirical research into knowledge brokering in social care. So perhaps this is something for you to address in your research.
Right. when I get a job.
Good luck with that. Good luck with that.
Thank you very much, Roman. Really interesting talk.
Thank you.
Thank you. Thanks, Suzanne. And there you go. There's a challenge to you. There's a whole new area there for you to explore. Lastly, I think, Jane, you had your hand up. I think we have got time to fit you in. That would be great.
Thank you. Yes. Again, all resonating with me as a senior nurse that's worked in practice managerial jobs and research jobs. I can see all of those angles. And following up from what Rebecca said, I think the knowledge brokering kind of role, I think, evolves in teams when you've got someone who, like you said, is passionate, who, you know, kind of naturally falls into that kind of role of becoming someone who is seen as, you know, someone who is a go-to person for knowledge, for, you know, the sort of up-to-date things around practice, about having the right skills and the connections to make those changes that are required. And in my day, we used to have roles like practice facilitators or practice development nurses, and that worked really well when you wanted to kind of implement some change in relation to research or any kind of evidence-based practice. And you know, given the situation with the NHS generally, recruitment and the numbers on the shop floor, those roles have all just gone, and I think that just makes it so much harder to implement things. And then when we do want to implement something, it's usually a kind of a checklist or something that's been driven from top down, and it's so much harder to implement in a team, you know, on the shop floor, something like that, because they just see it as being something that, you know, well, what's in it for me? And, well, you know, how does this make any difference? Because they don't understand the context or the background. So any of those elements that are missing, it is just so difficult to do.
I think you do have to be a particularly gritty sort of individual to soldier on and do those things. So thank you.
Oh, so thank you for your observation. And many people talk about our context as targets and terror. And that's everywhere in the public sector, especially in academia at the moment. And there is very little we can realistically do. We can speak out, of course, and, you know, complain on Twitter. But I don't see any change coming, unfortunately. So we have to survive somehow.
But I do think we need to acknowledge that we need to nurture those people with those abilities and skills and facilitate them to be able to facilitate others.
Absolutely. So that they can end up being leaders of those teams.
Yeah.
And they ideally would be able to deal with all those bureaucratic things that are inevitable, but still remember about the actual work that we are here to do. And I think that's important in the targets and terror culture, to still keep doing the important thing despite all the distractions that we have around us, unfortunately.
Thank you.
Thank you, Jane. And thanks to everybody for the really interesting discussion, and especially to Roman for prompting all those thoughts and discussions as well. Really interesting, and look forward to continuing some of these discussions as well within the research group. So our time is up, unfortunately. But just again, thank you to Roman, and thanks to everybody.
Thank you for having me.
We'll see you at the next seminar.
See you. Bye.